Good afternoon, friends. Myself, Dr. Yogesh Waghela, consultant intensivist, Phoenix Hospital, Naroda, Phoenix Hospital, Guyandeu. Today, we are going to discuss something regarding the poisoning cases which we are routinely receiving in our ICU. If I have to broadly categorize this, most of the cases are suicidal cases. Few of them are having accidental poisoning cases. In suicidal cases also, if I have to categorize it in commonly presenting it to the patient who is coming from the urban area and patient who are coming from the rural area. In the urban area, we are commonly having a patients who are taking over-the-counter medications that's routinely available without prescription, or they are already on a medication due to underlying comorbid illness. They take overdose of that treatment. So drug overdose is the most common cause of poisoning in an urban area. And if I have to name few of them, most common are sleeping pills, that's a benzodiazepine group of medication, antidepressant, antipsychotic, anti-epileptic. Apart from that, the paracetamol, painkillers, overdose of the medication to control the diabetes, and the antihypertensive treatment, blood pressure controlling treatments. So we are commonly seeing this medication overdose. That's one of the common thing. Apart from that, the mosquito repellent, phenyl, and the insecticides which are available, and the herbicides whichever being used. So overdose of all these is also very common presentation apart from the medication use. When I have to categorize a few of the patients who are coming from the rural area, most common cause of the poisoning patients in rural area are insecticides, which includes the organophosphorus, paraquat, and aluminum phosphide. Because routine farming they are using it, and commonly patient present to us in a suicidal poisoning cases, overdose of these drugs. Accidental poisoning, the person who are working in the chemical industry, they have a routine exposure to the chemicals. One of the commonly seen thing is that methemoglobinemia. The patient who work in a chemical factories can present to that. Apart from that, pediatric age group, unknowingly taking that medication, unknowingly taking acidic content may end up with a difficult situation. When it comes to management of the poisoning part, broadly categorized in a immediate management. Immediate management, if the patient comes to you or comes to a center like us, tertiary care center, ICU, having all the equipment to manage such a difficult situation, within 1 hour, if you can do a gastric lavage, that's a simple procedure to put the food pipe through the nose into the stomach and do washing at the earliest, so remove all the medications or all the poisonous substance available in the stomach. Apart from that, to insert the activated charcoal, this is kind of a binder agent which will bind the poisonous material and decrease its absorption. Apart from this, if the relatives have brought the specific poisonous material or a medication, we can provide the specific antidote. For the medication part, specific antidotes are available, and by timely instituting the medication, we are definitely going to give the good result. So many medications are dialysable, so for that patient, immediate dialysis required. Sometimes that medication dose very significantly high, and that amount present in the blood is also very significantly high. We have to do a hemofiltration. In a single patient's term, we have to make patient's blood to pass through a particular filter, charcoal filter like things, so we can get good result apart from that. So many times in a poisoning like organophosphorus or sleeping pill high dose, patient's neurological status is very low, breathing is not adequate, practically respiratory failure is there. In that case, we have to intubate the patient and keep him on a ventilator for a very long period of time. So, take home message is that whenever you encounter such an unfortunate situation, try to bring the patient at the earliest to a tertiary care center or to a ICU which is equipped with all the facilities as I have mentioned, like a ventilator, dialysis, hemofiltration, which can save the precious life. Thank you.